Okay. I hope this records, because if it doesn't, I don't know what I'm going to do with myself. All right, so we're just going to run through all the stuff from this week's lecture. So just quickly before we start, we're going to start off with ligaments, right? So the anterior longitudinal ligament, posterior ligament, and supraspinous ligament are all multisegmental, whereas ligamentum flavum, intertransverse, and interspinous ligament are all unisegmental. And we're going to go into what that means in a bit and throughout this, yeah. So firstly, starting off with anterior longitudinal ligament, that's the anteriormost ligament. So it's on that side of the vertebral body. Now, what it means by being multisegmental is I'm going to draw this out for you guys, or you, Josh. All right. So anterior longitudinal ligament runs like that. Yep. Now we look at posterior longitudinal ligament. That's on the posterior side, behind the vertebral body. And that's longitudinal, so it runs like that on the back side. Over here, where X is where the spinal cord will run. I think it's called the spinal canal. Can't remember. I don't care. Ligamentum flavum, I think in real life, in like a cadaveric model, it's yellow. So I'm just going to get yellow and make that yellow. Ligamentum flavum is the first unisegmental one we're doing. And it's posterior to the spinal cord. Okay, well, you can't see that. Yeah. That's better. It's posterior to the spinal cord. So it's elastic, doesn't compress the spinal cord, okay? How that runs is just like boom, 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 sort of. So it's unisegmental, doesn't go continuously throughout. Next, let's look at the intertransverse ligament. So it's inter, between, transverse, so between transverse processes. The way it works, it runs from here and then up. So if we were to draw it, how should I represent this? Draw it coming out like here. So we'd imagine a transverse process coming out towards the screen, towards you. It'd be X and then up, and then X and then up, X, up. Notice how here they don't actually connect. So they're unisegmental. They're one segment at a time. Interspinous ligament goes similarly between the spinous processes. So that's going to be sort of here, this area. Notice how again the ligament's not touching. So to represent it here, there'd be one below this spinous process. So I'll just draw like that, representing below. And there's going to be one above, connecting it to the next vertebra above it. That's interspinous. That's also an unisegmental ligament. Now let's look at supraspinous, which is in dark green, which is our last multi-segmental ligament. That runs from this endpoint right there, up and down. So to draw it here would run like that. So these three are our multi-segmentals, and these three, or four, sorry, not three. These three are unis, right? Ligaments, done, boom, good work, guys. Now, let's look at the superior, I think we call them, what do you call them? Superior extrinsic muscles or superior X something muscles. I don't remember. Anyways, let's just look at them. So you got lats. Lats, I remember, L equals lower. So in the lower half of the back. And they're going to sort of look like, they'll look like that. Yep, that's a lat. It's a small lat. So trap, T equals triangle. So that's an L. So the lats I like drawing like this. Oh, it's a terrible triangle. Like that. So the traps are above the lats. Here. Now, let's look at the rhomboid muscles. The rhomboid muscles look like a rhombus and will sort of be below here. So I'm just going to draw it as being deeper to here and just peeking out there. That's rhomboid. Levator scapulae would attach to our scapula. Since it needs to elevate the scapula, that means it needs to be above it so it can pull it up above. If it was below it, it would pull it down, and that would be depressor scapulae, which doesn't exist. Now, moving on to the next one. Erector Spinae. That literally means erect the spine. So when it contracts, its function is to make the spine nice and sturdy. So Erector Spinae consists of 3 muscles. I like to use the I love spinach acronym to get us the iliocostalis, longissimus, spinalis. This is the lateral most, and this is the medial most. So it's also important to note that each of these muscles span 6 segments, and after I'm done drawing these out in whatever way I can, I'll try and artistically represent that for you guys. But starting off with the spinalis, it's the most medial muscle, goes between spinous processes and spans 6 segments. So if I were to draw like that, being a bunch of spinous processes, it would run sort of, let's make that in red, straight down like that. Now, let's do longissimus. Let's draw some transverse processes out there. These dots represented by, let's make them a little darker and a little bigger so we can see them when I color on top. So longissimus, or longissimus, goes the long way around. So it goes sort of like that. Now for the last one, iliocostalis. Remember, costal, the word costal means ribs. So it will actually attach, let's just draw some terrible ribs here. It will actually attach to the ribs and go up that way. What's also important to note is that the origin point is all the same for this, a tendon called the sacrospinalis tendon. And these span 6 segments each. So in a way to represent it, I'm going to draw a bunch of vertebral bodies here. That's 5, 6, 1, 2, 3, 4, 5, 6. Right? And we just draw their spinous processes. And I'm going to do this for the spinalis muscle because it's the easiest to draw. The muscle fiber will start at X and will go up 6. Go X and go up 6. So the muscle actually attaches 1 and then skips and then attaches at the 6th. And that's the same for the longissimus. So it will go start off here with my X's, and then it will actually directly attach to 1, 2, 3, 4, 5, 6 here. And same for iliocostalis. What's important to note is when they contract, they'll erect the spine because of the way they're oriented straight. And since they're on both sides, when they contract unilaterally, they'll bring the spine into erection. All right, the next group is transversospinalis. So transverse process to spinous process. Let's start off with the rototores. So I'm going to draw, this is the spinous process, this is the transverse process, spinous, transverse, spinous, transverse, spinous, transverse, spinous, transverse, and spinous, transverse. Yeah, I'll change them up so they don't all look the same. Right, so start off with the rototores muscle. This rotate. So what that means is that the fibers will be almost like that, and it will cross 1 to 2 segments, which makes sense. Since the fiber is more in an oblique angle, it will only pass that way. It's like when we did, triangles in math, the hypotenuse would be a long fiber, but it would vertically be the least. So it would only cross 2 segments. So it would start off from the transverse process here and come down to 1 or 2 segments like there. So that's rototores. Now let's look at semispinalis, or let's go multifidus next. Multifidus as a muscle is less rotationary, so it will be more vertical, and it will cross 2 to 4 segments. So it will sort of start here, and then go down 2 to 4 segments there. So it's still a little oblique, but most of it, when contracted bilaterally, will probably produce mostly extension, and because it passes 2 to 4 segments. Semispinalis is a very interesting muscle because its name tells you where it is, semispinalis, so half spine. So it will only be in the upper half of the spine and span 6 segments. What the 6 segments tell us, it's extremely vertical because it needs to get past 6 when it starts. So it goes to here and then boom, spans all the way up there like that. It goes past 6. Yeah. Or 6+, yeah, according to Lloyd. I mean, I'm not saying anything. Okay, now let's look at the neck muscles quickly. This was a little hard to draw, but let's go back to our traps. Remember our triangular muscles like that. Nice. Underneath them, so deep to them, we have another muscle called splenius, which I like drawing like this. And it's literally called bandage. So if you see a muscle that's looking like a large bandage around the neck, it's splenius. Okay, now onto the last group. So these are the suboccipital muscles, and these are hard. These are, conceptually, I found them very difficult. So what's important to remember is suboccipital. So it's very high up and very close to the ox, which is like the skull area. That's not actually an anatomical word, so ignore that. So what this involves is our specialized cervical vertebra, atlas and axis. Right? So the axis has these transverse processes on either side. And there are 4 main muscles that we need to look at for this bit. And just starting off, rectus capitis posterior major, or I'm just going to call it rectus major and rectus minor. These two are paired. Rectus means straight, so the orientation will be straight. Obliquus superioris and obliquus inferioris. So these two are together, and their orientation will be slightly more oblique, right? So let's look at oblique. Let's start with the bottommost muscle, right? So we're going to do obliquus capitis inferioris. Its name is actually a bit of deception because it doesn't actually attach to any oblique bit. Any capitis, which is the skull cap. So this muscle will originate from X here of the axis, which is, we'll just call it the spinous process of axis. So that will go towards the transverse process of atlas. So that's oblique capitis inferioris. Now, let's look at oblique capitis superioris or oblique superioris. This one will go from that transverse process to the back of the skull. Let's just call it back of skull, the capitis of the skull. And that will run from that transverse process of atlas up there. Now, those are the obliques done. Now let's look at the rectus ones. Let's start off with rectus capitis posterior major. So rectus capitis posterior major actually originates at a very similar location, slightly above than obliquus inferior. So let's do that in this color. Since, remember, major means big, so major will be bigger than minor in this case. So what it does is it runs sort of obliquely there, upwards towards the back of the skull. It will assert in a very similar point to obliquus capitis superioris. Superior means above, so inferior is below, superior is above. Now let's just do obliquus posterior minor quickly, and that runs from the atlas towards the back of the skull. Now what's important about this area is this space here, which I believe is called the suboccipital triangle, which is one of the anatomical spaces. What's important about this is that it contains the vertebral arteries, which go on to then make the anterior longitudinal artery and possibly the posterior longitudinal artery, but I'm not 100% sure about that. Hopefully this worked.